Very good morning to all of you. Today we will discuss about the TMJ joint and the posture of the human body. Whether there is any relation between the TMJ joint, temporomandibular joint and posture. So come to our topic, TMJ and posture. Whether there is any relationship between temporomandibular joint and the posture. So this is our TM joint. This condyle is there. Ear canal, fossa, disc, and condyles. And this is the mandible. So posture is a complex multifactorial problem that can be affected by different systems, including neurological, visual, musculoskeletal, and somatosensory. Postural adjustment are the result of a complex system of mechanisms that are controlled by multisensory input, that is visual, vestibular, and somatosensory, integrated in the CNS. So posture is controlled by visual, vestibular, somatosensory, and CNS. So TMJ joint is more common in women than men, and 1 in 8 affected by the TMJ joint symptom, and the common symptoms are headache, neck pain, pain in jaw, jaw popping, dizziness, swelling, joint locking, muscle spasm. And the interesting symptoms are back pain, knee ache, migraine, tinnitus, obstructive sleep apnea, ear pain, etc. So the question same, is there is any relationship? Yes. In this study, global body posture evaluation in patient with TMJ joint disorders, the conclusion was our results suggest a close relationship between body posture and TM joint disorder, though it is not possible to determine whether postural deviation are the cause or result of the disorder. And next is TMJ joint disorder is a multifactorial, and sometimes it is hard to realize the reason behind it. One of the unnoticed reasons of the TMJ joint disorder is a bad posture. Yes, bad posture. The chain theory of the body linkage explains the relationship between bad posture and TM joint. The chain consisted of interconnected 3 rings, upper ring, middle ring, and lower ring. The upper ring consists of muscle of TMJ, head and spine. The middle ring consists of muscle of back and vertebra as shown in picture, while the lower ring consists of muscle of foot, ankle, and leg. For normal daily function, each of these rings must be coordinated, synchronized with other rings to act properly and for proper balance and posture. These are all 3 rings, first ring, second ring, and third. In this general TMJ and posture, yes, it is all connected, the chain theory of body linkage. In this it describes, yes, all body system from head to toe is connected. Now come to the dental occlusion. The stomatognathing system, especially the TMJ and occlusion, also play an important role in postural control. If you have a malocclusion, the muscle tension and activity will also be unbalanced. So, normal first class occlusion, second class, and third class. In first class occlusion, that is when the body is properly aligned. In second class, when upper jaw is forward, then the body's tendency to move or to going into forward direction. And in third class, when the upper jaw is backward and lower jaw is forward, then there is a tendency of body to lean backward direction, or there is tendency to fall backward. When those muscles are over contracted, it impact and pull the muscle that hold your head, creating a forward head posture. This slouch action is mimicked down your body, pulling and stressing your face, neck, shoulder, and back muscles, while can result in having one shoulder or a hip higher than another. When the TMG is involved, posture is involved, then your neck muscle is also involved, and you have a forward head posture. Forward head movement causes strain on the muscle of the neck and shoulder and upper back muscles. This causes decrease in blood supply of the muscle and muscle fatigue and pain. This movement led to shifting the center of gravity. As a result, upper body and back middle ring try to compensate by drafting backward, while the hip and lower body lowering moving forward. So the TMJ and the neck problem can result in the middle and lower back problem due to loss of balance between all these ring and body chain. In this study, relationship between head posture and temporomandibular dysfunction syndrome, the conclusion was that the study supports the hypothesis that poor posture causes muscle imbalance and pain, which are highly correlated with developing temporomandibular dysfunction syndrome. Next is the stomatognathic system is a functional complex of tissue and organ located within the oral and craniofacial cavity. The craniofacial anatomical factor and the biomechanical of the temporomandibular joint affect many systems throughout the body, including organ of the vision. In this system, is composed of several parts which process mastication, deglutition, phonation, respiration, other behavioral characteristics or activities. So what happened? Dental pathologies, activation of shortening muscle system, postural alteration, and orthopedic pathology. In this study, the prevalence of first onset of temporomandibular disorder in low back pain and associated risk factor. The conclusion of this study was low back pain is a risk factor contributing to development of first onset of temporomandibular disorders. Therefore, appropriate TMJ joint disorder management clinician should be reminded to manage both LBP disorder and TMD concurrently, especially among individuals presenting with the associated risk factor such as age 20 to 39 years with IP and osteoporosis. That means when a patient came to you with a low back pain or temporomandibular disorder, you can check both. If TMJ disorder is, the back pain should be there. If back pain should be back pain, patient come with back pain, then TMJ joint disorder. So they both are interrelated. So when you are planning to treat, look all these things before treating the patient. Next, come to the high heels, which are very popular in females, and one of the most popular reason for the increasing incidence of temporomandibular joint disorder. Why? I am explaining. By the wearing of high heels, there is potential damage of the ankle and foot, by which there is shortening of Achilles tendon. Then it leads tightening and shortening of the tendon, resulting in the heel pain. To toe, then center of gravity is changed. The calf muscles are contracting and adjust to the angle of high heel, and walking with this high heel making excessive force within the knee, lowering. That is lowering. The high heel push the center of gravity, center of body forward, taking the hip and spine foot of the normal alignment. That is middle zone. All of previously mentioned changes led to posture alteration, which affect the craniocervical and TMJ muscles, that is upper. So, what are other factors affecting the posture, including TMJ joint disorder? First is high heel, already mentioned. Children which are carry heavy backpacks for their school books. Long time using computer with positioning of the screen at lower level lead to forward of the head, that is forward head posture. Long time watching and playing the video games, especially in children's, not only lead to bad posture but also lead to body adaptation of the new bad posture. So next is chronic pain conditions. TMJ joint disorder leads to pain, then pain leads to poor sleep quality lead to disease associated with poor sleep, that is sleep apnea, depression, insomnia, and with the sleep disorder, again chronic painful illness, that is pain. This is the physical or psychological stress due to pain, sleep. So both these, all three are interconnected. Pain due to orofacial fibromyalgia, whatever the condition, this pain lead to sleep disorder lead to physical and psychological stress, then again pain and poor quality of sleep. So can you imagine that TMJ joint disorder leads to sleep apnea, depression and insomnia. So whenever you treat the patient, consider all these things before treating the patient. So in this study, stress level and quality of sleep in subject with temporomandibular joint dysfunction. Conclusion of this study was both quality of sleep and stress level were associated with temporomandibular joint disorder in this sample. Again, the another study, effect of chewing ability during quiet standing in healthy young male. What is the result and conclusion of this study? While during chewing, the results show that center of gravity velocity decreased significantly while chewing in comparison to both open and resting jaw position. Our finding corroborate previous study and suggest that the jaw sensory motor system can modulate postural control mechanism. Jaw gum chewing activity can enhance the postural stability during upright on the unstable surface and in the absence of visual input in healthy adult. Our results should be taken into consideration in the treatment of rehabilitation planning for posture patient with postural instability. The conclusion, what is the conclusion? The conclusion was that when we are treating the patient which is unstable or patient with postural problem, then in the rehabilitation phase, when we give the chewing gum to the patient and then we start our rehabilitation, then in upright posture, the posture stability is increased when we are giving the chewing gum to the patient for upright position. It is very helpful to the physios who are treating the postural instability or neuro rehabilitation or balance problem in their patient. So try this. Next is the acute effect of tongue position in the mouth or on knee isokinetic test performance, a highly surprising study in which the discussion was the present study show a significant improvement in the isokinetic knee performance with the tongue in up position compared to test with the mid and low position. In first figure, upside, this is the mid position, this is up position, and this is the low position. First one is mid, second one is middle one is up, and third one, lower one, C, is low position. So the study shows that significant improvement in isokinetic knee performance with the tongue in the up position compared to the test with mid and low position. The improvement occurred at both low and high speed, that is during both endurance and high force muscular exercise respectively. So we can consider this position of the tongue also when we are giving treatment or rehabilitate the patient in rehabilitation. So what is the prevention of this TMJ joint disorder? First is reduce the backpack of the children's. Maximum backpack should not more than 50% of the child weight. Second, the pillow should be roughly as thick as the distance between your ear and your shoulder. When you are lying sleeping on sideline, then the head and shoulder, this distance should be filled by this pillow. During back sleeping, that is in supine position, either you place a small towel roll, that is your occiput should be touched on the mattress, or you can take a very thin pillow. In this lower one picture, your head is already in forward position when you are using high pillow. So during back sleeping, the back of your head should be in contact with the mattress. The pillow that holds the back of your head above your mattress. Reinforce forward head posture. A pillow that held your head in a forward position all night will lead to walking and standing with the same forward head posture. Therefore, your pillow should be provide support under your neck rather than under your head. The neck support can be provided by U-shaped pillow or rolled up towel or pillow with a hole in the middle. Improve your resting posture by holding yourself as tall as possible. Treatment. Remember to check the TMJ joint and the cervical area. Adjusting the bite may be needed as part of integrating postural improvement program. Wear sports comfortable shoes, no high heels. Sit up in a straight position. Try to align the head over the neck and shoulder. Support your back with the back pillow during sitting for a long time. Home exercise for TMJ joint disorder. Isometric opening, tongue clicks, isometric deviation, masseter release, chin retraction, and jaw protraction. These are the apps in your mobile. Your mobile is full of all these apps. I am talking about the physiotherapy students. Your mobile should be full of this type of apps which can help you in your study, assessment, and treatment. These mobiles are free of cost, like Shoulder Decide, Knees Decide, and Spine Decide, Pocket Anatomy, Muscle and Bone Anatomy 3D, CMC Slow Frame Video Analysis, PT Pal Pro, Pain Therapy, Physical Therapy Exercise Video, Physio Advisor, Blue JPT, goniometer, clinometer, tilt meter, muscle trigger point, posture analysis, physical therapy case file, core clinical orthopedic exam. Remind yourself that you don't have to do what everyone else is doing. Be special, be different, just be yourself. This is our YouTube channel, Physiolite Health and Education Society. You can check it, like it, subscribe it, share it, comment it. Thank you for your listening. Thank you very much. Thank you for your patience. See you soon. Thank you.